we evaluated the long-term effect of Mavacamten on patients with hypertrophic cardiomyopathy. So Mavacamten is a medication that was approved in April of 2022 by the FDA to treat obstructive hypertrophic cardiomyopathy. The goal is to relieve the LVOT obstruction, the obstruction in the heart, make people feel better. Hi, my name is Saeed Al-Sidawi. I'm one of the cardiologists here at Mayo Clinic, Arizona, and I'm director of the Hypertrophic Cardiomyopathy Clinic. So it's my pleasure to talk about our new article that we recently got accepted at the Mayo Clinic Proceeding, titled Electrophysiologic and Anatomic Changes in Obstructive Hypertrophic Cardiomyopathy Patients on Mavacamten, 1-year insights from AI-ECG and echocardiography data, and then should show up in the October version of the journal. One of the topics we've been interested in is how this medication performs long-term, what effect is going to have on the heart long-term after using it. So we've published some of our work at 3-month and 6-month mark after using the medication, but this article is focusing on studying the effect of the medication on the heart after 1 year of using this medication. And we try to tackle this topic from multiple angles. So we try to look at how it does from patient symptom standpoint, from the echocardiogram standpoint. And we looked at something interesting, which is how the performance is on the artificial intelligence applied to an EKG in these patients who are on this medication. And the results were encouraging. A lot of our patients that we see ask us, how is this medication going to perform long term? How is this medication helping my heart long term? And that's what we try to answer with this article. I know the patient is feeling better immediately when we put them on the medication, but what happens a year after taking the medication? The answer to that is we're seeing positive signs. So the medication is showing improvement in the shape of the heart, improvement in the relaxation of the heart, and we're getting no concerning signals in terms of increasing rhythm issues or drop in ejection fraction on this medication. We found that their echo parameters continue to improve. Their heart stiffness and diastolic function improve. Their pulmonary pressures improve, and the size of the upper chamber of the heart improves. These are all signs we call positive remodeling. So the way their heart is looking on the echocardiogram was improving after using the medication for a year. Now, the interesting component about this project is when we looked at the artificial intelligence applied to the EKG, which is a Mayo platform, a Mayo Clinic platform, where we look at multiple parameters on the EKG that can predict also the response to the medication. One of these parameters is the diagnosis of hypertrophic cardiomyopathy. So we think when the EKG picks up hypertrophic cardiomyopathy by artificial intelligence, that this reflects the severity of the phenotype of hypertrophic cardiomyopathy in these patients. Interestingly, what we saw on this in this paper is that when we have the patients on this medication for a year, the EKG was less likely to detect the diagnosis of hypertrophic cardiomyopathy. The artificial intelligence program gave it a lower score or lower chance of hypertrophic cardiomyopathy. This was an interesting thing because that means phenotypically the heart is getting better. The other parameter we looked at is the aortic stenosis score, also on the artificial intelligence applied to EKG. We use that as a surrogate for obstruction in the heart. We also saw the score coming down. So in summary, in a year after using the medication, we're finding a lot of encouraging signs that the hearts are getting better based on multiple things we're looking at: the echocardiogram, patient symptoms, and artificial intelligence applied to EKG. All interesting things, reassuring things, and encouraging things. Now, where do we take this from here? What are the future directions after doing such a project? Couple of thoughts. Number one, we need to compare it to other modalities. We have other ways of treatments to treat the obstruction in these patients: medications, surgeries, other procedures. So how is this medication, Mavacamten, is performing compared to other interventions, maybe looking at the same parameters? Now, more importantly, we're looking at surrogates now. All of these things, improvement in the heart shape, the relaxation of the heart, or the artificial intelligence, are surrogates of improvement in outcome, but is it really going to translate into improvement in outcome? So we need to continue to monitor these patients long term and see how is this going to translate into their life expectancy and then more improvement in their symptoms. So that's in summary what the project was about. We invite you to read it when it's out. It's going to be as a research letter.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.